Website Treatment Wiki presents mesothelioma and asbestosis. Question: Mesothelioma treatment option. Here is the answer. What are the mesothelioma treatment option? Mesothelioma treatment option to date. There are no uniform standards for the treatment of mesothelioma. One of the reasons, lack of randomized clinical trials that compared to various treatments. Have applied a variety of approaches to the treatment of mesothelioma, from palliative care and chemotherapy prior to major surgery. The choice of approach depends on the patient's age, comorbidities, and general condition. The real effectiveness of the treatment efficacy of individual treatments for mesothelioma is not defined. Mesothelioma treatment option: surgical. For some patients with mesothelioma, the best option is surgery. One of the arguments in favor of this treatment is that mesothelioma is characterized by the local spread of the neighboring structures such as the chest wall and mediastinum, before the advent of distant metastases. Thus, surgery may also have therapeutic and palliative effect. There are two main types of operations: pleural pneumoectomy (PES) and pleurectomy, decortication (PD). PES is resected en bloc parietal pleura, lung, pericardium and diaphragm. Opinions on the surgical treatment of mesothelioma diverge. Mesothelioma treatment option: chemotherapy. Mesothelioma, the most effective in monotherapy, showed antiphthalates platinum. Based on the results of the study, the combination of cisplatin and pemetrexed was officially approved by the FDA for the treatment of mesothelioma and is included in the standard therapy of this disease. Moreover, a research shows the effectiveness of alternative chemotherapeutic agents, particularly phthalate antimetabolites and platinum. To date, research continues on the effectiveness of second-line chemotherapy for mesothelioma. In addition to chemotherapy, the possibility of the use of targeted therapies for mesothelioma. Mesothelioma treatment option: radiation therapy. The majority of patients with mesothelioma chemotherapy is ineffective. Radiation therapy is often used for palliation. Radiation therapy can reduce the incidence of local recurrence in patients with early-stage mesothelioma who underwent irradiation of the affected part of the chest, lower the risk of recurrence in the area of operations, but significantly higher risk of distant metastasis. In treating most of these patients, use a combination of surgery, chemotherapy and radiotherapy.